And turning to China's Xizang autonomous region, the benefits of modernization are shared by all, and this is evident in the healthcare system, where better medical assistance can be seen in China's lowland urban cities, has made its way to remote Naqu, some 4,500 meters above the sea level. Huang Yue has more.
This premature baby girl was born after just 6 months of pregnancy in a car hours from home. She weighed less than 1,000 grams, and in the past, babies this small would not have survived here. But now, things have changed for the better.
We used endotracheal intubation to help her breathe, a technique that couldn't be performed on preemies before 2015. In 2024, our critical neonatal death rate dropped by 1% and transfers dropped by 4%.
The young mother was originally headed to a hospital in Lhasa, more than 12 hours away by car. But she gave birth halfway there. While she was admitted to a nearby hospital, the baby was rushed here to Naqu People's Hospital. Now, she visits her daughter in the NICU 3 times a week.
Don't worry too much. We now have experience treating infants under 1,000 grams. With modern equipment, ventilators, and antibiotics, we can stabilize even the most fragile newborns. Her lungs and immune system are still immature, but she's holding on.
Tian Congliang is a neonatal expert from northeast China's Liaoning province. He has come to Xizang under a group-style medical assistant program launched in 2015 that sends doctors across China to the highland for sustained medical support. Doctors like Tian not only help treat patients, but also train local medical workers.
I
started my career here in 2003. Back then, the hospital conditions were poor. We only had 21 beds at pediatrics, no advanced equipment, no proper space. We could barely treat babies under 2,000 grams. If they were under 1,000 grams, we had no choice but to give up.
Thanks to doctors like Tian, who even carries a portable oxygen tank on his back during daily rounds, the hospital has become one of the highest altitude tertiary grade facilities in the country.
Over the past decade, more than 150 doctors, including myself, have come to support the hospital, and we've introduced over 290 advanced procedures. We've built 5 major centers: an emergency and trauma center, a maternal ICU, a neonatal ICU, a stroke center, and a chest pain center.
Naqu is China's highest altitude prefecture-level city, with fewer than 2 people per square kilometer. In the past, residents either traveled long distances for treatment or had to settle for limited county-level medical care. Today, nearly 500,000 people can access high-quality medical services close to home. Naqu's transformation mirrors the broader progress unfolding across Xizang. In 2023, the region's maternal mortality rate dropped to about 38 per 100,000, and the infant mortality rate fell to 5 per 1,000, both reaching historical lows. By 2024, Xizang had built over 7,200 medical institutions, including more than 5,200 village clinics. The number of hospital beds has surpassed 21,000, more than double that of 2012. Over the past 6 decades, average life expectancy in the region has risen from 35.5 years to 72.5, a remarkable leap. Behind these figures is a story of resilience and investment, of new hospitals rising, medical services reaching the most remote areas, and a stronger healthcare safety net for people across the plateau. This baby girl has no idea how high the mountains are, but her first breath was taken on the plateau. Here, survival is never taken for granted, and each day more families are leaving this hospital with hope, reassurance, and the strength to face whatever lies ahead. 王月 CGTN Naqu City, Xizang Autonomous Region.